Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we can't see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you very much, Rachel. Good morning, everybody. I hope everybody is adjusting to this daylight savings time change that we're all experiencing. I really kind of enjoy it. Last night it was so nice to be outside and see all the kids in the neighborhood playing late and enjoying the sunshine and stuff. What I didn't enjoy was the alarm clock going off this morning in the middle of the night. It just really is a shakeup that is really, really hard. But let's go ahead and get started on our topic for today. We really appreciate everybody joining us today and being here for this month's Medicare Monday. Wanted to remind everybody that the Medicare Mondays is brought to you as part of the Medicare Assistance Program, which is funded by grants from the Administration for Community Living, which gives us funding to go out and educate beneficiaries on Medicare, how Medicare works, and what are the different parts of Medicare, and what are their options related to Medicare, as well as helping people recognize Medicare fraud. What are the things that they need to be doing to protect themselves from becoming a victim of Medicare fraud? And then another big part of what we try to do is to help people who are low income to be able to afford their medications and their health care, and to identify areas where maybe they can get some assistance. And that's what we're going to talk about today. Before we get to our main topic for today, though, I did want to remind everybody that this month is the last month for the Medicare Advantage open enrollment period. That's the period that's from January 1st through March 31st. And if you're somebody or you know someone that's on a Medicare Advantage plan and they want to make a change to a different Medicare Advantage plan, or possibly get off of a Medicare Advantage plan and go back to traditional Medicare, the deadline for doing that is going to be March 31st. So if someone has some questions about that, they'd like some more information, have them give us a call at the Medicare Assistance Program, 1-800-763-2828. We'd be happy to help them. But our topic for today is going to be cost savings programs. This is a big topic. You know, Medicare is a great program. It covers a lot of our costs. Approximately 80% of the costs for healthcare are covered by Medicare, Parts A and Part B. And that's a significant amount of the charges. However, that still leaves quite a bit of money out there that has to come out of somebody's pocket. The Kaiser Family Foundation back in 2022 did a study, and they said the Medicare household spends approximately an average of $7,000 on healthcare every year. And that's compared to a non-Medicare household, which spends an average of $4,900. So, you know, about $2,000 difference there between someone that's on Medicare and someone that's not. So what's available to help for people who are on Medicare? Those are the other big defining difference between people on Medicare and people who are not on Medicare. Most of the time, the people on Medicare It's a fixed income. They're not going to get a raise necessarily that year. So what are the things that people can do to maybe help with those costs? So I'm pushing the wrong button. Maybe let's try this button and see if this one helps. Let's see here. There we go. So some fun programs that are out there that can help are actually funded by both the state and the federal government. There's sort of a shared program between the two entities. The first one, the one that people are most familiar with, is Medicaid. Also in Oklahoma, we refer to it as Sooner Care. And it's available for people, not just for people who are on Medicare, but also people who are just low income. They don't have to be of the age that they can get Medicare yet. The other thing about Medicaid is it's also available to cover some services that Medicare doesn't cover, like some homekeeping type services for an individual. And the guidelines for qualifying for Medicaid are much more detailed. They get into things like the number of people in the household, and the income guidelines can be a lot more detailed. We're not going to get into the Medicaid side of things very detailed today because that's really handled by the Oklahoma Healthcare Authority, and the enrollment is done by Oklahoma Human Services. So we're going to focus more on the things that are specific to Medicare, but I did want to mention Medicaid. It's a great program that's out there, and if someone thinks they're available, we've got the contact information later on in the presentation. We're going to start out talking about Medicare savings programs, which works with the beneficiary's Medicare benefits. It's a program that comes in alongside your Medicare to help cover those costs, those out-of-pocket costs for the beneficiary. Now, here is a slide that kind of shows you what the different Medicare savings programs that are available. There's three different ones that we've got that we're going to talk about today. The first one being the Qualified Medicare Beneficiary Program, or the QMB program. A person that qualifies for this program is going to benefit from having their Part A and Part B premiums paid. It also eliminates any cost sharing that they might have on the Medicare program. So if we broke that down a little bit, most people have their Part A premium paid already, but there's still that Part B monthly premium, which this year is $185. Then if a person does go in the hospital, the first thing that they would have to pay is going to be the Part A deductible, which is $1,676. Well, if a person qualifies for the QMB program, they would not have that out-of-pocket costs. So as you can see, this could be a very great financial savings for someone who qualifies. So what are those qualifications? Well, for an individual, your monthly income would have to be $1,325 or less, or for a married couple, $1,783 or less. The asset limit for folks would be $9,660, or for a couple, $14,470. Now, the next one we're going to talk about, and by the way, we're going to talk a little bit more about what counts as income and assets here in just a moment. The next MSP that we're going to talk about is the Specified Low Income Medicare Beneficiary, or the SLIMB program. This one has a little bit higher income and asset limits, and if you qualify for it, it's going to pay your Part B monthly premium. Now, it's not going to cover anything as far as Part A. It's not going to cover your copays or coinsurance or deductibles, but it does cover that Part B monthly premium, which, going off of what the Part B monthly premiums are for this year, that's about $2,200 for the year. That's a substantial savings. For an individual, you would have to be at $1,585 a month as an individual for income. For a couple, it's $2,135. The asset limits are the same, whether we're talking about QMB or SLIMB. Now, the third one we're talking about is the Qualifying Individual, or the QI program. It has the same benefits as the SLIMB program, which is it pays for the Part B monthly premium. The reason why there's a different program for this is they're paid from different funds at the federal government level. So with the qualifying individual program, you may have to apply each year, whereas with the SLIMBY program, you don't necessarily have to reapply each year. And as you can see from our slide, the income and the income limits are a little bit higher for the qualifying individual program. An individual can make up to $1,781 and a couple can make up to $2,400. So what counts as income and what counts as an asset? Your Social Security benefits, pensions, employer income. Those are the things that are going to count as income. Anything that's coming into the house. Let's say you've got rental property and you collect rent from that property on a monthly basis, things like that. Assets, those are going to be your savings account, your checking account balance, stocks, bonds, any real estate that you own outside of the home you live in, mutual funds. Sometimes it's easier to look at it in terms of what doesn't count as an asset. So here's some things that don't count as an asset. The home that you currently live in, that's not going to count as an asset. And probably the property that it sits on. So let's say that the home you live in sits on 5 acres. That's not going to count as an asset. The car you drive, the goods in your home, and that includes, by the way, your wedding ring, your engagement ring. Those aren't going to count as assets. Burial spaces, burial funds up to $1,500 per person. Also, if you've got a policy that is specifically for the purposes of covering your burial, it doesn't have any cash value, it's just simply a policy to cover your burial, that would also not count because the only thing it's going to be good for is to pay for your funeral. Okay, so what are the other benefits and rights that you have if you qualify for a Medicare savings program? For one thing, it allows you to enroll in Medicare outside of the regular enrollment periods. You know, you've got the initial enrollment period when you first qualify for Medicare, but then outside of that, you're pretty much stuck with the general enrollment period, which is January 1st through March 31st. If you qualify for a Medicare savings program, you can actually go ahead and enroll in Medicare outside of that time frame. It also eliminates any penalties that you might have incurred because you didn't get enrolled in Medicare when you were first eligible. So that can really help out a lot. We've talked to people in the past that have had significant. The penalty for late enrollment for Part B is 10% of the current monthly premium for every 12-month period you were eligible and not enrolled. And just recently, I spoke with a gentleman who would have had a $240 a month penalty. That would have been added to the current $185 monthly premium. So his monthly premium would have been, it was close to $400. So this could be a huge savings for someone who's never been on Medicare Part B. So the other thing that's great about the Quimby program is, as we said in the previous slide, if you qualify for this, you're not going to have to pay your monthly Part B premium. You also don't have any cost sharing. You don't have the deductibles. You don't have the co-payments and things like that. So as long as you're going to a Medicare participating provider, a doctor who has agreed to accept Medicare payment as payment in full, you're not going to have any out-of-pocket expenses. So it's going to be very important that you're paying attention to your Medicare summary notices, those documents that you're getting in the mail from Medicare that show who the doctors are that you've seen, what the services were that you received, and how much they charged for those, to make sure that they're not showing that you owe anything. Because if you're on the Quimby program, you shouldn't have any out-of-pocket costs for seeing participating providers. The other nice thing about the Medicare savings programs is you automatically qualify for extra help, which is a low-income subsidy that helps with prescription costs that we're going to talk about here next. Now, if you're going to apply for a Medicare savings program in Oklahoma, the best way to do that is to either go to the website okdhslive.org, or you can call 405-522-5050. You're going to have to complete an application form. You're going to have to participate in an interview. They're going to need to get some very specific information for you. And then within 30 to 60 days, you'll receive a notice about whether your application has been approved. One of the reasons why you want to go through this process to apply for the Medicare savings programs is because Oklahoma also has other programs that you may qualify for. And in some circumstances, you may qualify for one or the other. In other words, there are some programs that are out there that you may, such as the Advantage Waiver Program that is offered in Oklahoma, which is fantastic. It offers some in-home services that can allow a person to stay in their home rather than having to go to an alternate place to live because they need some additional assistance. But unfortunately, you would either have to choose to be part of the Advantage Waiver Program or part of the Medicare savings programs. So that's why I encourage people get on the phone, talk to the folks at Oklahoma Human Services to find out which of these programs is going to give you the services that you need that's going to help you the most where you're at. Okay, so now let's talk about assistance with prescription drug costs. That's the Extra Help program that I mentioned earlier. This is a federal program. It's not a shared program between the state and the Fed. It's a 100% federal program. It's a low-income subsidy that pays the premiums for your Part D prescription drug plan, and it lowers your copays that you pay for your prescription drugs. If you qualify for Medicaid, for the Medicare savings programs, for supplemental security income, for any of those, you do qualify for extra help. If not, if you don't already qualify for the Medicare savings programs, that's okay. You can still qualify based on your income and your assets because there is an income and asset limit that's actually higher than what it was for the MSPs. As you can see on this slide, the income limit for an individual to qualify for extra help is $1,976, and for a couple is $2,664. The asset limit for an individual is $17,600, and for a couple is $35,130. So, and by the way, the income and asset limits do change on an annual basis. It's very important that you take a look at, review, be aware that those limits can change. You may qualify this year, but next year, if those limits change, you may find yourself in a position where you have to reapply or something. So pay attention to that. If you do meet the income and asset limits for these programs, you're going to have you're not going to have to pay a monthly premium for your Part D drug plan. You won't have a deductible for your plan, and it reduces the copays for your medications. Your generic copay is $4.90, and your brand name copay is $12.15 this year. So this program can actually save you a whole lot of money, particularly if you've noticed what the costs right now are for prescription medications. So a lot of people have saved a lot of money utilizing this Extra Help program. Additional benefits of Extra Help program, there's no late enrollment penalty. Just like there was for the Part B late enrollment, there is a late enrollment penalty if you didn't enroll in Part D when you were first eligible. If you qualify for Extra Help, that eliminates that late enrollment penalty. Also, it allows you to get enrolled in a different Part D drug plan throughout the year. So let's say that you're enrolled in Extra Help, you're on a Part D drug plan, but perhaps at some point in time during the year, your doctor needs to prescribe you a new medication because of some condition that you have that isn't on the formulary for your current Part D drug plan. That's okay. You can call us, you can talk to somebody, or you can call Medicare, and we can get you enrolled in a different Part D prescription drug plan that does include that new medication. So this is a great benefit because it keeps you from having to pay out of pocket for that new medication. Now, something that is a new change also for this year, you can make this change once a month to a different Part D drug plan. However, if you're on a Medicare Advantage plan, if you're getting your prescription drug coverage through a Medicare Advantage plan, you would not be able to switch to another Medicare Advantage plan. Your option would be to go to a standalone prescription drug plan. You can't switch to another MA plan. So if you did choose to take advantage of this option, your only option would be to go off of the Medicare Advantage plan into a standalone prescription drug plan. So it's something that's important to think about before you make that change. To apply for extra help, you can actually do that through our office at the Medicare Assistance Program. The phone number is right there, 800-763-2828. I meant to put it on here. I completely forgot. You can also email us at map, that's MAP, at oid.ok.gov. You can also apply yourself. If you would like to, you can go to that website there on the socialsecurity.gov website, and you can fill out the application yourself. So by all means, if you're that kind of a person, you want to do that sort of thing, help yourself. So let's say that you are someone who, unfortunately, maybe you're a little bit over the income and asset limits for any of the programs that we've talked about so far. And you're unfortunately on a medication that costs too much for you to pay out of pocket, and it's creating a hardship for you. I want to make sure that you're aware of the fact that there are these pharmaceutical manufacturer patient assistance programs. And we've all heard, we may not have heard this terminology used with them, but if you've watched TV and you've seen a pharmacy ad for these high cost drugs, at the very end, a lot of times you'll hear them say, if you're having trouble affording your medication, such and such drug company may be able to help. That's one of these patient assistance programs. And so these are the drug manufacturers themselves who have created these programs that might be able to help somebody who's lower income. You don't have to necessarily be very, very, very poor before you can qualify for these. They actually have higher income brackets than the Extra Help program does. But you contact these companies and they're going to have you fill out paperwork. They're going to have you submit documents, like you might have to provide your tax documents and things like that. They're going to ask you questions, all sorts of stuff like that. But if you qualify, you can get that medication at a greatly reduced price, possibly even at no cost, because what they do is they work with your current insurance. So you are probably going to have a prescription drug plan, a Part D plan that would work with this. You can't just go directly to them and expect them to cover 100% of it. Now, it can be a little daunting. There is a lot of paperwork. There is hoops that you've got to jump through and stuff. So I want to make sure that you're aware that Oklahoma is very fortunate to have a program called RX for Oklahoma. Okay? This is a program that helps Oklahomans apply for these prescription assistance programs. RX for Oklahoma, in and of itself, does not have a fund. They don't have a pool of money that they pay for prescriptions with. What they do is they actually know about these prescription assistance programs and other ways to help people get their prescriptions covered. You contact them and tell them your situation, and they will help you figure out any ways that are possible to help you get your prescriptions at the best possible cost. They don't, and this isn't based on age, by the way. If you know someone that's not on Medicare and they need some assistance, RX for Oklahoma is happy to help them. There is their phone number, 1-877-RX4-OKLA, and that's their website there as well. I have seen these people do amazing things for people, and it just simplifies that process of getting in touch with these prescription assistance programs. So I encourage you to reach out and talk to them. They divide the state into these regions. So if you call this phone number, be sure, looking at this map, you can tell them what region that you're calling from, because that helps them get you to the person that's going to be able to help you get the assistance that you need. All right. Now, the other thing that I wanted to make sure that we mention is other things. You hear about GoodRx and other prescription savings programs. These are those discount cards that you hear about whenever you're at the pharmacy. Those are great. I mean, they can save you some money too, but keep in mind, it's not insurance. If you're using a GoodRx card or one of those others, you may find that you can get your prescription for cheaper than if you were to use your insurance, but it doesn't replace your insurance. So I always encourage people, by all means, if you want to talk to your pharmacist and say, hey, is it going to be cheaper if I use this or if I use my insurance? Do that. But don't cancel your insurance, because I promise you there's going to be a time when your insurance is going to be the way that you're going to get the better price for that medication. The other thing to keep in mind is with the prescription drug cards, the price is going to fluctuate. What you pay for a drug this month may not be the same as what you pay for it next month. It's going to vary. Each one of those cards have different features. Some of them are, they sound like they're free, but once you actually get started using the card, you find out that if you want the better savings, you actually have to pay a fee. So learn how those cards work before you use them. We don't get involved with the cards. We don't push the cards. We don't do anything with those pharmacy cards. But I did want to mention them to you because I know a lot of people are using them, and they're using them alongside their insurance. They won't work with your insurance, by the way. That's the other thing that I wanted to point out. You can't use your prescription drug card and then get additional savings with the pharmacy card. It doesn't work that way. So some other resources for healthcare, not necessarily related to prescription. We talked about Sooner Care, the Medicaid folks. That's the phone number and the contact information if you'd like to learn more about Sooner Care, as well as some other state programs, SNAP. Any of those state programs, you can go to okdhslive.org, and it lists all of those programs. Another great resource is the Health Alliance for the Uninsured. This is a program that connect uninsured people with free or low-cost clinics. There's their website and their phone number. Also, we have federally qualified health centers. These are facilities that offer preventive and primary care services. They also offer dental and mental health services as well. There's a website, findahealthcenter.hrsa.gov, that you can go to that will tell you where those federally qualified health centers are. So there's options. There's ways that people can get health care and be seen. So by all means, don't go without. Don't just go straight to the emergency room. Try and seek care, particularly the preventive and primary care, before you get sick. If you stay well, you're going to be in a lot better shape than if you wait till you get sick. Always in these presentations, we try to point out who our partners are across the state that work with us to provide this counseling and information. These are the agencies that we work with. By all means, reach out to those folks and talk to them, and ask them if they can help you. And Rachel, do we have any questions?
Yes, so we just had one, and that question was, is there an email address that can be used to apply for the extra help, or is it just the phone number and the website?
There is, and I'll pull that back over here. It's on the socialsecurity.gov website. So it's going to be ssa.gov/Medicare /part D extra help.
Okay, so
See how
that's the
easy
website URL.
that?
So is that, if they go to the website, will they be able to find an email address?
An
Because
email
the question,
address? Now,
yeah, the
if they're
question
wanting
is
an
there an email
email,
address?
I would recommend that they email us. There's not an
Okay,
email
perfect.
for extra help. They just need to contact us at map@oid.ok.gov,
Perfect.
and we
That
can
answers
help
that
them.
question.
We're going to go there. I apologize. I thought they wanted
No,
that.
you're good.
But anything else, anybody? All right. I appreciate everybody joining us. I want to remind you that next month our topic is going to be preventive services. As I said just a moment ago, you need to stay healthy. And the best way to do that is to take advantage of the preventive services that are offered by Medicare, uh, that many of which are covered at 100%. And there's no point in not taking advantage of those. Uh, Research has shown it's so much easier to treat something if it's caught in its earliest stages. So let's talk about those next month. What's covered, when, and how often. So I hope everybody has a great month, and we look forward to seeing you next month. Good luck with daylight savings time.